job seriously, that will listen to the counsel of scientists and doctors. And they understand, the president's team, president-elect's team, understands this is a problem that goes way beyond just the private sector alone. You definitely need a strong, robust government involvement. They're going to work to drive down the infection rate, ensure vaccines and new treatments are safe. And he made it clear, just having a vaccine, Leader McConnell said, well, we have a vaccine, we don't need a bill. It's not close to enough. There are so many other things that have to be done in addition to the vaccine, and it's going to take, unfortunately, even under the best of circumstances, a considerable amount of time before everybody is vaccinated. It's also going to take considerable educating the public that the vaccine is okay before everyone is vaccinated. So we feel very, very strongly that we have to move forward. The needs of the American people didn't go away after the election. They're still hurting. Families hit hardest by the pandemic still are struggling to keep food on the table, a roof over their heads. So we're going to have to work together, and we are looking for a comprehensive bill that meets the needs of America. And we agree with the House on this issue. So pressure is on Republicans to deliver. Leader McConnell and all of my Republican colleagues will have an opportunity to show the American people that they're ready to get to work and meet the moment of this crisis. Democrats are going to work to get a strong bill done. We hope our Republican colleagues will join us to finish the job. And I'm just going to make one other point on another issue, and that is that so many Republicans today seem to be backing the president on his lawsuits. Make no mistake about it. This is this is not one state where there's a 597 vote difference. These are many states where there are tens of thousands of votes different. And the Republicans have no legal case. They are politically distraught, but that's not going to create any success for them in the courts. Bobby.
I want to thank Senator Schumer and Senator Murphy, Senator Baldwin for being with us. I wanted to start today with the words of the President back in May. He said, and I'm quoting, "We want to terminate health care under," and what he called Obamacare, I'll refer to as the Affordable Care Act. Terminate health care, that was his goal. Now, everything he's done in his 4 years as president has been in furtherance of that goal, and everything Republicans in the Senate have done has been the same. So when I think about, for Pennsylvania, terminating health care under the Affordable Care Act, I think about a lot of numbers, 5.5 million people with a pre-existing condition, 1 million people lose coverage. But maybe more than the numbers, it's the people. Just in the last couple of weeks, and even in one case over a long period of time, I've come to know a couple of families who would be directly affected. So I don't think of the numbers. I think of Erin and her daughter Abby. I think of Shannon and her daughter Sienna. Sienna has Down syndrome. Abby has multiple complex medical needs. So for those mothers, destroying the ACA is personal to them and would devastate their lives. If the court strikes down the Affordable Care Act, it will be an act of injustice, and it would be, in my judgment, robbery, judicial robbery. People have coverage now for, and I won't go into all of it, you already know the data, but that would be robbery by the court. And Republicans in the Senate for about a decade now have lied about this. They've lied over and over again. They said they would come up with a replacement. They never have. I don't think they ever even intended to, because they would have had it done by now. And they also lied that they could do it a different way. They can come up with a bill that covered more than 20 million people, had all the protections and all the gains for filling the donut hole, all the other protections, but they could do it a Republican, less expensive way. That is a lie. and everyone knows that. So they've been lying for a decade about it. Now we're on the precipice of a Supreme Court decision in a few months that could wipe out all those gains. And here's what it wipes out in terms of Medicaid expansion. This has been a lifeline to so many Americans. We know that most of the coverage gains for Medicaid expansion in my home state, of the million who got coverage, 840,000 plus got coverage through Medicaid expansion. That means that someone who had a substance use disorder problem, subset of that is the opioid crisis, they got coverage and treatment because of it. Just in Pennsylvania, in 1 year, 2019, over 135,000 people were able to receive treatment for a substance use disorder problem because they had Medicaid expansion, only because they had that coverage. We know, you know the story about the donut hole that's been filled because of the Affordable Care Act and what that's meant to so many seniors. We're told that in 2016 alone, close to 5 million Americans on Medicare received an average of $1,090 per person in donut hole savings. So the benefits to this, literally the benefit to saving lives, let alone just coverage, are numerous. So when we go into these next couple of weeks of debate on a COVID-19 relief bill, I believe it has to focus on at least 3 groups of Americans. More than this, but these are the 3 priorities in my judgment. Older Americans, communities of color, and people with disabilities. And the way to help all 3 is somewhat interrelated. To help people with disabilities, we need to invest in home and community-based services. That means Medicaid funding. To help communities of color, we need to invest in Medicaid for the obvious reasons. And finally, for older Americans, we need to put in place a strategy to get the case number and the death number down in nursing homes. More than 91,000 Americans have died in nursing homes. When you combine the resident deaths and the worker deaths together, 91,000 and counting. There's no excuse for that happening. There's no excuse why we can't knock that number down. Finally, let me say this. When I talked about Shannon and Aaron when I started out, here's what Shannon said, and I'll close with this. Her daughter, Sienna, as I said, has Down syndrome. She talks about all the fights they've had to wage. The name of the group, as you all know, is Little Lobbyists. Just the fact that this group exists is an indictment of Washington, that they needed to become advocates such that they would call themselves lobbyists. Here's what she said. Once again, we as parents are forced to suit up for battle and prove that our children are worthy of health care, unquote. Why the hell should parents have to suit up for battle to help their children in the United States of America? Because a group of ideologues are at the Supreme Court now telling them to strike it down. That is perverse, it's disgusting, and it's un-American.
Thank you, Leader Schumer, for bringing us together, and congratulations on your election as leader for the 117th Congress. And I wanted to add to your remarks about how having guest speaker at our caucus was so uplifting today, to think about having science and medicine respected and guiding our response to this pandemic. And it made me also sad about how much we've missed that for so long. And I did want to note one thing for the public record. The leader mentioned our caucus lunch, but we might or might not have been eating lunch at the time, but it was virtual. We were on the phone, distanced, et cetera. Yes. I just want to remind people that that's how the Democratic caucus has been conducting its business.
No one saw my peanut butter and jelly.
Yes, we could all describe, but I digress. While it's not labeled as such, and I apologize, that is Wisconsin data that you see on the graph to my right. That is basically, since our first cases in the state of Wisconsin, the new COVID-19 confirmed cases by the date confirmed, and then the blue solid line is the 7-day average in our state. Nationally, we know we have just passed the 10 million COVID-19 case mark in this country, and we know tragically that more than 235 Americans have died. My home state has one of the worst outbreaks of COVID-19 infections in the country, and we are experiencing the worst phase of this pandemic since it began. For the first time this past Saturday, Wisconsin reported more than 7,000 cases in a single day. And yesterday, Wisconsin added 4,360 new infections. Over 2,000 Wisconsinites are currently hospitalized due to COVID-19, and that's an increase of more than 350 just in the past week. And again, so tragically, 2,329 Wisconsin souls have been lost to this disease. Hospitals and healthcare workers do not have the supplies they need. We are running out of ICU beds, and we have completely overwhelmed our state's healthcare system. In my state, the pandemic is getting worse, not better. And we have seen a complete and total failure of the President of the United States, President Trump, to provide any sort of leadership that we can count on. Trump gave up trying. I'll repeat that. Trump simply gave up trying to control this pandemic. And Wisconsinites are paying the price with their health, with their lives, and with their livelihoods. Here in Washington, with the Senate Republicans in charge, we have seen no sense of urgency to pass COVID-19 relief, and no sense that it needs to not just be relief, but it needs to address the terrifying scope of this public health and economic crisis. As we know, the House passed the HEROES Act 6 months ago, and it's been sitting on the majority leader's desk in his legislative graveyard, as we call it, while small businesses have been closing, millions have lost their jobs, and hundreds of thousands of Americans have died. We must act on bipartisan legislation to provide local communities and the frontline healthcare workers with the support that they need to stop the spread of this deadly virus. And we must unify as a country and in Congress to now provide support to these workers, families, schools, local governments, and small businesses. This crisis is getting worse in Wisconsin and across the country, and now is the time for us to start working together in Washington, as hard as our frontline healthcare workers do, so that we can get this deadly pandemic under control, build back better, and move our economy forward for American families. And now I'll turn it over to Chris Murphy of Connecticut.
Thank you very much, Leader. Thank you, Senator Casey. Senator Baldwin, you've covered the topic very well, so I'll be quick, make 3 brief points. First, I was at a hospital in suburban New York, Stamford, Connecticut, and as I was on the way out, having met with their leadership, the head of the purchasing department followed me to the door. She wanted to have a private word with me. She said, I didn't want to say this in front of everybody else. I didn't want to get anybody in trouble, but I have no idea how many test kits I'm getting from day to day. I have no ability to plan beyond 48 hours to get events set up in the community to make sure that we're on the front lines of this epidemic. I can't do my job. And she can't do her job because this administration has completely failed us, has botched the response to this pandemic. And Senate Republicans have let the country down as well. We need a robust, comprehensive package of support that gets money to schools, that gets money to counties, to cities, to states, to healthcare providers, to make sure that they have everything they need in order to plan more than one day at a time. And to this day, Senate Republicans still do not take this pandemic seriously. They still cower behind President Trump, afraid to admit that this is a worsening pandemic because they risk the ire of the President of the United States. The second point. I know Justice Roberts said some things at that hearing today that gave people some hope that he may rule to keep the ACA in place, but he doesn't have to be on the prevailing side. There are 5 justices on that court, 3 appointed by the president, 2 that have ruled against the ACA in the past, who can form a majority to strike down the entirety of the ACA. The ACA is still at risk so long as Republican Attorney General and the Trump administration are pursuing this case in court. And they will not give up. Republicans are not going to give up just because they lose a case or 2 in the court system. This is their holy grail, the dismantling of the ACA. We are in for a long, hard fight. And then finally, Senator Schumer referenced the support from Senate Republicans regarding these bogus lawsuits. Every day that this transition doesn't start, it's harder for us to actually correct course in November. We will have the right people at HHS. We will have the right people at the CDC. We will have the right people leading coronavirus response for the first time in a long time when Joe Biden assumes the White House. But as this transition does not get underway, as Republicans continue to support the president's bogus claims of voter fraud, it risks the Biden administration not having the resources
don't win runoffs in Georgia. That's not true. There were two runoffs. He has not consulted me on that issue.
ACA, it's no surprise that it's the Supreme Court. If the Supreme Court does end up upholding the law, would that change your opinion?
No, I don't trust this court at all. And as one of my colleagues said, they're going to keep trying. They're so passionate against the ACA that they will keep at it. And I have very little faith in this court in terms of upholding the ACA. Last one.
Yes, sir. Vice President or President-elect Biden and Vice President-elect Harris are both Senate veterans. How is that going to make a difference next year?
I didn't hear the second person you mentioned, but Biden and Harris.
Harris.
Yeah, it's going to make a great difference. They know how to work with us. We know them. We're comfortable with them. I've been talking to President-elect Biden regularly on a whole gamut of issues. And I think the Democrats in the Senate will have a very close relationship. And, of course, we're all so proud of Kamala Harris. And she, again, has been in complete touch with us on so many different issues.
When Biden was vice president, though, he was able to come up here and work with Senator McConnell, as you recall. Have times changed so much that
Well, we'll see.
relationship...
Joe Biden has said he wants to bring the country together to get some real good things done. We agree with that. Thank you, everybody.
Jason once. He's like, I'm off. I was like, oh, sorry. He's like, no, it's okay. I'll put it on the schedule.